Why I Vaccinate. I'm Ann Thomas, and I am here with my co-host, Veronica McNally, and we now welcome two doctors to this segment of the show. We have Dr. Rachel Young, a family physician, and we also have Dr. Lynn Smitherman, a pediatrician. Doctors, thank you for being here. We really appreciate the time.
Thanks for having us.
So first question I'm going to address to Dr. Rachel Young. Dr. Young, talk to us a little bit about the advice that you're giving as a family physician with regard to Michigan's childhood vaccinations and people getting vaccinations this summer to get themselves and their children ready for school.
Thank you. So, we have noticed at our clinic over the past year that our well child checks as well as our adult physicals have dropped off by about 50%, which has been very alarming for us. And so we've made a real conscious effort over the past 6 months to reach out to any patient who is falling behind and make sure that we get them scheduled. As one of your guests mentioned earlier, schedules are filling up. We are booking out 6 to 8 weeks with all of our physicians in our clinic for these physicals to get caught up with immunization schedules. So, we highly recommend that people are coming back into the office. We've made lots of efforts to make it safe for everyone to come back in and be seen and to get caught up on their vaccines. We still have the same recommendations that we did prior to the pandemic, which is that we want everybody to become vaccinated, ideally on the recommended schedule.
Dr. Lynn Smitherman, same question for you as a pediatrician. What are you seeing? What are you telling your parents and the children?
Exactly. And my concern is that with children going to school face-to-face this fall, many of them have not come in over the last year and a half because of concerns of exposure to the COVID-19 virus. So I'm encouraging everybody to come in. We're located in Detroit, Michigan, and as you probably know, the vaccination rates in Detroit are lower than the rest of the state, hovering maybe around 50%. So we're very concerned. Last fall, actually, we did have a drive-through vaccine campaign in the parking lot where our office is located so that people could get caught up then. And we plan to do the same thing this fall as well. Call ahead of time, get in your cars, drive through, we'll vaccinate, and then you can keep going, similar to what they're doing with the COVID-19 vaccines.
So, Dr. Smitherman, let's address this issue of Detroiters being concerned about the vaccine. What are you saying to them, and how can you help them become less fearful about this vaccine and really, in reality, all vaccines?
All vaccines, and it is an ongoing problem. First of all, I lead them to credible resources, such as the Centers for Disease Control, the Michigan Department of Health and Human Services website, also the American Academy of Pediatrics, the National Medical Association, and the American Medical Association all have really good information. But the other thing I tell them, though, is my own experience. I raised 2 children in the city. I vaccinated them. And a lot of times there's a trust factor there. And I think if I can establish a level of trust with my patients and their parents and let them know my own experience and how valuable I think immunizations are, they tend to take that information, absorb it a little bit better, accept it a little bit better, and many times go ahead and vaccinate their children.
And Dr. Rachel Young, I see you shaking your head that you agree with this completely. Talk a little bit about your experience. How can you get parents and everybody back on track with regard to getting their exams and getting their vaccinations?
Yes, I think, a big part of it, as the other doctor said, is just starting with empathy, just connecting with your patient, building that relationship. And that's the wonderful thing about being in primary care is that for a lot of our patients, we do have these longer relationships and this trust that's built. So I know that when we get to have those conversations and share stories and share information together, that patients tend to feel confident. They want to know what their doctor has to say. So it is really important that we take the time to stop and have those conversations and answer questions. So I encourage my patients that are hesitant to, as she said, go check out the resources, do your research, come back, spend some time with me. Let's talk about it some more if we have hesitation. And let's do what's best. I also think it's important to let them know that just like they want to, I want to protect their child. and that we're on the same page. We both want the best for their child. And we may have a different approach in how to get there. But oftentimes, we'll find that patients are willing to change their mind on it once they have that confidence. And really that comes from having credible resources. I too share some of my personal experiences. For example, with the HPV vaccine, I like to let them know that I've seen cases of cancer showing up in teenagers related to HPV, and that's very scary for me. And I don't want to see that happen to their child. I also talk about how I lost my aunt at the age of 33 to chickenpox because the vaccine was not available at that time. And that these diseases are not just out there in the nebulous. These are real, and they are affecting people, and they are changing people's lives. So, again, I think the stories are great, the connection is great, and just meeting them where they are and letting them know that it's not bad for them to question. It's absolutely appropriate for them to have questions and to just help them find those answers.
And Veronica, we're both parents, and I think we both would agree that the personal stories and the reassurance that everything is going to be fine, that the side effects are no big deal if there's any at all, that, both doctors are giving great advice with regard to parents feeling more comfortable getting vaccines.
Oh, I couldn't agree more. I think that the approach that a provider takes in communicating with a parent or a patient makes all the difference in the world. And I want to just follow up on that for both of our guests here today and talk about the importance from your perspective of that strong provider recommendation, and whether you think in research or in your own personal experience, if that strong recommendation makes the difference in whether or not the patient will receive the vaccine.
I personally think so. And I've been around long enough, again, to see a lot of the diseases that these vaccines protect against. So I've seen Haemophilus influenza, and I've seen disseminated pneumococcal infections, and I've seen kids come into the hospital and not come out. And so I share that experience with my parents and the families, and just say, listen, if I have in my arsenal something to prevent the death or long-term disability of a child, I'm all for advocating that be done. And I understand that some people still have some hesitancy even with that, but I have no problem sitting down, discussing it, having them come back, not rushing them into making a decision. And sometimes, just that time and that thought gives them the opportunity to really kind of think through things. And then eventually they do come back and agree to get vaccinated.
Yeah, keeping that dialogue open, just letting them know that even though they're not maybe willing to vaccinate today, doesn't mean that we aren't going to bring it up every time they come in, and we aren't going to keep that conversation going. And I've had parents ask me that before. Well, we've talked about this. Why are you telling me this again? I'm like, I'm going to tell you every time because I think it's really important. And I'm going to keep this conversation going because people sometimes, most of the time I find are willing to change, even if it's on a delayed schedule or, doing one vaccine at a time. Most parents, in my experience, are willing to get on board. They just need to get there, and they need the time to build that confidence. And so again, as we build our relationship in care of their child, hopefully that confidence in vaccination also increases.
So when you are talking to a hesitant parent or a hesitant patient, talk about some of the concerns they're raising and what some of the points are that you're providing to them so that they can have all the information in front of them.
Some of the concerns that are raised, well, we don't see these diseases anymore. We don't see polio anymore. We don't see diphtheria anymore. And I mentioned, and that's because of vaccines. But however, we, still have open borders. We have people coming in from other areas of the world. And in those areas, some of those diseases are still rampant. And so, we are getting some of these live infections in. I also tell them that, immunizations are not always 100%. And so even though somebody might be vaccinated, there can be an exposure during a vulnerable period where they can get that infection as well. And then there are the conspiracy theories and, it's not safe or, it causes autism, you know, and all of those other things. I remember that study that linked autism to the MMR vaccine had been refuted, but unfortunately it had gone viral. It was only based on 4 cases that were, and it was an anecdotal study. It had nothing to do with autism. It had something to do with the gastrointestinal system. And again, you know, because, you know, these things kind of get out and then become urban legends, unfortunately, people that are really into conspiracy theories latch onto it. So I just provide, again, information, scientific information, personal experience, give them time to think about it, and hope that they eventually do come around.
Doctors, I think that parents are always weighing the risks and benefits of activities for their kids. And obviously, when we're talking about vaccination, they are making that same risk-benefit analysis. Can you talk about some of the safety systems that are in place and the process that the CDC goes through in making that risk-benefit analysis for all vaccines?
So the AICP is a group of scientists, doctors, and health professionals that are meeting on a regular basis multiple times per year to review any existing vaccines or new vaccines. And when they look at the research, they make recommendations for the vaccination schedule. And then this is the schedule that the CDC provides to the public and recommends. And that's recommended on that schedule, not only because it's effective, but also because it's been deemed safe for children at those ages. The main things that they're looking at is the risk of the child contracting the disease and also the potential side effects from those disease being a higher risk at certain age groups. They're also looking at the immune response. And so when we vaccinate at certain ages, we're confirming that we're going to get a good and reliable response from that vaccination and adequate protection. So, you know, these recommendations are made for a reason. A lot of patients ask me, well, why can't I just do it on a delay? And I think the important thing to know is that those delayed schedules haven't been researched, and we don't know if your child will have the same immune response. And so that's one concern. And the second piece is that they may not be protected during their most vulnerable times to catch these infections. As you know well, right, Veronica, with whooping cough or other things, you know, if these happen in really small people, that their risk is much greater. So it's very important that we have those conversations with parents about why going on schedule is important.
And finally, Dr. Smitherman, I just want to touch on the COVID vaccine. What are you saying to parents with regard to making sure their kids get the vaccine if they're able to, if they're old enough, and returning to school? Everybody's probably talking about this.
Yes, it is. And it is a battle. It is a challenge. Again, because of what has been in the media over the last year and a half about the vaccine, the safetiness, how quickly it was rushed to get into the arms of people. And so I say a few things. I say, first of all, children are going back to school face to face. They've been kind of isolated. They need this. And it's not just from a physical health standpoint, it's for a mental health standpoint only. We've seen cases of mental health illnesses over the last year and a half, especially in our teenagers and our young adults that have been isolated. This is not normal for them. And so this is one step to get them back into some sense of normality. So that's very important. The other thing is that now that we've got our older people vaccinated and safe, that now, you know, the younger ones that we're worried about, and they're going to be in contact with each other. So they are now our highly vulnerable group in terms of getting the COVID-19 infection. And so some people say, well, young people don't get it as bad as others. Well, you need to sit in the lobby at Children's Hospital of Michigan and talk to some of those parents, because all it takes is for one child to get sick and go in the hospital and not come out to really change somebody's mind. So yeah, the majority of children will do okay, but some don't. And you can't predict who's going to do well and who's not. So why not get everybody protected just to be on the safe side? And it's everybody. It doesn't matter if you have a chronic illness or you're completely healthy. You just don't know. And even though I'm fully vaccinated, I still make sure that I keep my distance and I wear my mask, because the majority of my patients cannot be vaccinated, number one. I don't know whether or not I don't want to carry disease to somebody else. And then it's simply out of respect for the entire community. Because if I'm demonstrating the appropriate things to do to stay safe, hopefully other people will pick up on that.
Dr. Lynn Smitherman and Dr. Rachel Young, thank you so much for your time and your expertise today. We really appreciate it.
Thank you.
Coming up next, a conversation about adding the meningitis B vaccine to the schedule. You are listening to Why I Vaccinate. We'll be back right after these messages.